good definition of what I do is examine, diagnose, and treat visual disorders and eye disease. That can stem from glasses, contacts, medical treatment of glaucoma, and even where I work, we do a lot of removal of metal from eyes. We work in an industrial park area. So my town is about 15 minutes from an industrial park, so we have metal removals almost weekly. So that's a big part of my practice. When I graduated from optometry college, I took a job as a clinical professor at one of the school's clinics. So I was the teacher there and the chief optometrist there. 2 years later, or a year and a half later, I started my practice in July of 2009. We had no patients, we just opened the doors, and it's grown beautifully. We've been very blessed. It's been a good experience. The ones that are most important to me is a program called Infant C. We provide free eye exams for infants up to 1 year of age. So we make sure that they don't have any sight-threatening problems that would obstruct their development. And we want to make sure that everyone has access to that. Another thing we do is every year before school kicks off, we do a county-wide school screening for any child who wants to come. We just start and take a day, and probably, I think last year we saw around 80 or 90 kids. They don't all show up, but that helps a lot. And we usually, about 50% of those get referrals to their parents that they need something assessed before they start their school year. Another thing we offer is cataract, glaucoma, and diabetic free screenings for elderly. So they come in, we at least give them a chance to see if they have any type of eye disease where they need routine or periodic care of their eyes to make sure that nothing happens to their sight. I participate in the Chamber of Commerce in the town I work in, and I try to twice a year go to a classroom, and the teachers of that middle school, I try to gather them up and show them, teach them how to monitor in their classroom for kids who are having problems with their vision, because they're with the kids the most. They catch things way more than the parents because they see the kids actively working with their eyes. So try to do that twice a year. That's some other small things, but those are the big ones. I want to grow my practice that I started because it's become my passion and my goal in life. But an ideal situation for me is to start a secondary practice, develop it. I would like it to focus on children's eye care. It's not an absolute, but it's what I'm shooting for now. And my long-term goal, even past 10 years, I would like to retire and go back to the school where I graduated from and teach as an optometric professor. It was very hard for me to leave. I loved what I did, and I want to go back to that when I'm done in the private sector.